Hi, I'm Dr. Wayne Lee, and I have my assistant here, Rachel Brodsky, our nurse. We're going to show you our adaptation of the reusable elastomeric respirator for use during the COVID-19 viral pandemic N-95 shortage. Obviously, the disclaimer is that this is not FDA approved, but if you are short, this may be a good solution. So we will add the link for Dr. Brianna Slatnick's YouTube video. She's a resident from Boston Children's Hospital, so look for the link at the end. Here are the supplies that you will need. First, you will need adult large anesthesia mask. You can also use a medium size as well. We took a anesthesia circuit that's adult size, and on it has two BV filters, bacterial and antiviral filters. This is a elastic that we bought from Walmart. It's a 1-inch, and you just kind of cut to your size that you need. For adult size, we measure that the upper band elastic will be 62 centimeters, and the bottom band around your neck will be 52 centimeters. So I pre-cut that. Here's one of the antiviral filters. There's a 5 cc syringe. You can adjust the amount of air in this anesthesia mask to allow for a better fitting. You need a pair of scissors and some surgical silk tape, which is very easy to obtain. There are these prongs, 4 prongs on this anesthesia mask. You can turn this so that you have 2 on the upper and 2 on the bottom. So on the top one, you'll need the slightly larger one. And you just very carefully use the edge of scissors and just swivel, and you make a gentle opening here. Don't cut it so it won't unravel. And you just place it over this plastic piece, and you wrap it around, and you do the same thing. This is kind of like a belt where you can have multiple holes, so you can adjust as needed. So that's the upper band. That's a little bit longer, and then I would proceed with the bottom elastic band. Added security so that this doesn't easily pop off, we're going to use the silk tape. So peel the silk tape, take a rectangular piece in a similar fashion without cutting it, just gently push, and this adhesive will help to secure it in place. Okay, so the longer end is on top, the shorter end is around the bottom. And then you take your antiviral filter. There's only one way that it can fit, and you just wedge this on. Okay. Hi, this is Dr. Wayne Lee again. I'm going to show you how to place on this reusable elastomeric respirator. If you wear glasses, it's easier to put it on. You take your glasses off. If you have long hair, put it in a bun. It'll make it easier. So with your non-dominant hand, you want to hold the mask and the filter. And on one side, just gently remove the elastic strap. Place it over your face and nose. Bring the top strap over, and it's easier to do it in front of a mirror. Now I proceed with the bottom strap, which goes around your neck. You can adjust the mask on your mouth and nose. And put your glasses back on. Here's a 5 cc syringe.
If you need to add air or subtract air to make a better seal, you can do that. Now you want to do a leak test. So if you put your hand over the filter and take a deep breath in, you shouldn't be able to bring in any air. Then you want to do an expiratory leak test. So if you put your hand over the filter and you blow out, you shouldn't be able to expel any air. And there, I passed the leak test.
And this can be disinfected using a cavi wipe or any disinfectant that you may have. And you can reuse this until it's soiled, and or you can change out the filter when it's soiled.